posterior cerebral circulation. Vertebrobasilar circulation is different in presentation because it has supply to various structures in the brainstem and the cerebellum. Vertebral artery, where does it arise from? Innominate artery on the right side and subclavian artery on the left side. V1 is origin to C6 foramen. V2 is C6 to C2, cervical 6 to 2. V3 segment leaves C2 and pierces the dural at foramen magnum. It pierces the dura at foramen magnum. V4 joins the other vertebral artery to form the basilar artery at the pontomedullary junction. What are the branches of vertebral artery? You can see anterior spinal artery, posterior spinal artery. There are two pairs of anterospinal and single posterior spinal artery from each. Pica, posterior inferior cerebellar artery, the artery in relation with lateral medullary syndrome. The major artery, if they ask, is vertebral artery. First you should say lateral medullary syndrome, the first artery involved is vertebral artery, followed by posterior inferior cerebellar artery. Arises at the lower end of the olive and winds around the medulla to pontomedullary junction. This is what is pica. This is what is pica. There are medullary branches and meningeal branches, which applies to the meninges.